Medicare Advantage Plan or Medicare Supplement Plan? Which is better coverage? Hi, my name is Robert Bache. People call me MedicareBob. I own Senior Healthcare Direct, and I promise after a few minutes you're going to understand the differences between a Medicare Advantage plan and a Medicare Supplement Plan, and then we'll talk about which is really better. So let's first give you my explanation of how I simply explain an Advantage plan, and then we'll look at a more detailed explanation of each and even look at examples for each. So this is MedicareBob's explanation. Medicare Advantage, this is also called Medicare Part C. It is a private alternative replacement to Medicare Parts A and B. Medicare Supplement, which is also called Medigap, is a health plan that you pay an extra monthly premium for that will then actually fill in the gaps to Medicare. So let's look at more in-depth information about a Medicare Advantage plan. So these are also called Medicare Part C. Like if you read some of the Medicare and You book and see some advertisements on TV, the term Medicare Advantage is interchangeable with Medicare Part C. So looking at it, the first thing you want to understand is a Medicare Advantage plan is not a supplement. It's actually a private alternative to Medicare. Your Medicare Part B premium, you know, that $134 or whichever, some people pay a different amount, but that money that's usually coming out of your Social Security check or that you're paying to Social Security, well, that Part B premium is no longer going to technically go to Medicare. It's going to go to whichever private Medicare Advantage plan you choose. So you will not actually use your Medicare card. You will just use whatever Medicare Advantage plan card that you're issued. Now, if you're confused about what you're seeing on TV, especially in October and November, you're going to see Medicare Advantage plans advertised as zero premium plans or Medicare all-in-one plans. So that's how you know, that's how you can identify if you're seeing an advertisement that it's a Medicare Advantage, is when you see a zero premium or when they say all-in-one. Medicare Advantage plans are HMOs or PPOs. So that means you will have to go to certain doctors and certain hospitals. So Medicare, again, is not getting your premium, and you won't use your Medicare card. You'll just use the card they issue you. Well, part of that, because they're getting your monthly premium and Medicare is not, you have to go to their doctors. Now, when you sign up for an Advantage plan, you sign an annual contract. Well, the doctors and hospitals don't. So one thing you have to be careful of is that the doctor can drop out of that plan at any time, but you can only do it certain times of the year. Something else to understand about an Advantage plan is it does not pay the 20% that Medicare doesn't pay. Instead, it's going to replace Medicare's out-of-pocket costs with their own set of copays, deductibles, and max out-of-pocket. So again, you're not really using your Medicare card or your Medicare set Part A and B benefits, so you're going to have a whole different set of benefits. It's a whole different benefit package. With a Medicare Advantage plan, what you have to understand is your healthcare cost is not fixed. It's pay as you go. You're going to have copays or out-of-pocket costs for everything you do. So what I wanted to do is let's take a look at what a typical Medicare Advantage plan looks like. Now, I'm not allowed to give company names about Advantage plans that go into like this whole long approval process. So I just took one from a random county and put it on here so you guys can get an idea of what an Advantage plan looks like. So this particular plan is an HMO, which means you have to stay only in network. You have to go to their doctors. And usually HMOs are stronger on benefits because they can control their costs because you're going to have to go to certain doctors. Well, let's just look at this, highlighting it here. Normally, if you're on an Advantage plan, you're looking at, with this particular plan, a $15 copay. If you go to a primary care, specialist visit's going to be $45. Again, this is a real plan. If you go to the hospital, here's my point when I say an Advantage plan doesn't actually pay the bills that Medicare charges. If you have Medicare and you go to the hospital, you would have a $1,300 deductible. Well, an Advantage plan doesn't pay that for you. Instead, it replaces it with a copay. For example, this plan is $275 per day, each day, days 1 through 7. So if you go for one day, it's going to be $275. Well, that's a lot better than Medicare. But if you go for 7 days, now it's actually more than what Medicare would have charged you with the $1,300. Looking at diagnostic tests, x-rays, and lab services, those you're going to have copay for those usually. can range really even higher than this, or sometimes some preventative stuff's going to be free. But on this particular plan, it says it's going to be $25 to $75. You don't know. It's not like you can call the plan and ask them. You're going to have to wait till you get billed for that and you actually go for that lab work or x-ray or test. This is kind of a downside here. An outpatient procedure. Let's say you need a knee replacement or cataract surgery. Well, on this particular plan, it actually does pay 80%, so you would pay the other 20% up until your max out of pocket. So for an outpatient procedure, you're going to have to pay a 20% co-insurance. Basically, you're going to pay 20% unless that exceeds whatever the max out of pocket on the plan is, which we'll see this in a moment. Emergency room is going to be $75. An ambulance ride is $250. Annual deductible, really nice on most HMO Medicare Advantage plans. In most counties in the United States, they have a zero deductible, meaning you just have all these copays right off the bat. To where, like with a group insurance plan, you might have a $2,000 deductible, and then you get to these benefits. So what's nice about an Advantage plan is there's no deductible. These benefits kick in right away. This particular plan, which for 2017 is the national limit, is out of pocket is $6,700. That's the max out of pocket. So like when I talked about the outpatient procedure, let's say if God forbid you get cancer or something and you go multiple times for like chemotherapy or lots of treatments and you have to pay 20% for that. Well, once you reach $6,700, the plan's going to pay all of the rest of your bills. So that's really nice about Medicare Advantage is, worst case, I'm going to be out $6,700. Now, keep in mind that resets every year. So if you're going through something really bad and, let's say you meet that max out of pocket in November of 2017, but you're still going through those treatments, let's say in early 2018, unfortunately, every January 1st, the max out of pocket resets. So this is what an average Advantage HMO Medicare Advantage plan looks like. So now let's take a look at a Medicare Supplement Plan. Medicare Supplement Plans are also called Medigap. So if you're talking to your friends or you are reading some materials from Medicare and you see the word Medigap used, the word Medicare Supplement, interchangeable, mean exactly the same thing. With a Medicare Supplement is actually a supplement to Medicare. So it's actually going to pay the 20% that Medicare doesn't pay. So Medicare is going to pay 80, and then your supplement pays the other 20%. Your Part B premium still goes to Medicare, so you will use your Medicare card because Medicare is your primary. So you'll have your Medicare red, white, and blue card, and you'll have your supplement card. And anytime you go to the doctor, or God forbid you go to the hospital, or get a test or anything, you're going to give them your Medicare card and your supplement card. And they will do all the billing automatically. It's all electronic. And Medicare will pay 80%, and your supplement will pay the other 20%. Because Medicare is your primary, you can go to any doctor, any hospital in the country that accepts Medicare. Okay? So you don't have to get a referral. You don't there's no network, there's no HMO. You can go anywhere you want. You don't have to ask permission. As long as the doctor and hospitals accept Medicare, which I know in the news and stuff, people are saying not as many doctors take Medicare. Medicare is still the largest network in the country. Okay, so there's plenty of doctors and hospitals that accept Medicare. And so with the supplement, because Medicare is your primary, you can go anywhere you want to go. It travels with you in the country, and you don't have to ask for referral permission. As long as they take Medicare, they'll take your supplement, and you're in good shape. Now, a Medicare Supplement Plan does have an additional monthly premium. The pricing is based on zip code, gender, and age, and really I should have added company, because different companies charge different premiums for the same exact plan. A good supplement plan usually costs between $85 and $130 per month. Again, that is based on your zip code, gender, and age. But if you decide you want a Medicare supplement, make sure you work with a broker that represents all the companies, because again, different companies charge different prices for the same exact supplement. So it's important to get the best price. A good thing about a Medicare supplement is, yes, it's going to cost you more per month, but as long as you budget that monthly premium, your healthcare cost is a fixed annual cost. As long as you pay that monthly premium, no matter how many times you use it or you don't use it, you can expect what to pay each year, because as long as you pay that premium, you're not really going to have any other bills. So let's take a look at what a Medigap Medicare Supplement Plan looks like, an actual plan. So what we're going to look at is my favorite plan for 2017, and it's going to be this way for the next few years. Medicare Supplement Plan G. Now this is a nationwide plan. Plan G is the same with every company. It's the same in every state. Plan G. I call it greatest value if you're going to go with a supplement. And here's what it covers. A Medicare supplement plan is going to pay all your hospital bills. So what I mean by that is Medicare, if you have Medicare as your primary and you go to the hospital, you're going to have around a $1,300 deductible just for going to the hospital. Well, your Plan G actually pays that for you. So you pay nothing no matter how many times you go to the hospital if you have a supplement. It does pay the 20% that Medicare doesn't pay. So again, we covered that. Medicare is going to pay 80, and this Plan G or supplement is going to pay their 20%. With Medicare Supplement Plan G, there's no copays. There is the only out-of-pocket cost you would have if you go with the G plan is a 2017 annual deductible, which is only $183. So if you go with Plan G, as long as you pay that monthly premium, let's say it's $120 a month, you know, as long as you pay that monthly premium, your only out-of-pocket cost is going to be the $183 deductible. Now, something to keep in mind about Medicare supplement plans is the only time you're automatically approved for a supplement is 6 months before you turn 65 and 6 months after you turn 65, or 6 months of getting your Part B and 6 months after getting your Part B. Okay? The reason that's important is there's so many people I speak to that when they first turn 65, they get a Medicare Advantage plan because their mindset at that time is, hey, I'm healthy, it's cheaper per month, sometimes it just costs me a Medicare premium, and if my health deteriorates, then I'll upgrade to a supplement. Well, here's the facts. You can't do that because if you go with an Advantage plan when you first turn 65, and then let's say at 69, you have a heart attack, or at 68, something happens, you get diagnosed with something, a cancer or something like that, and you realize, oh, now I got to meet that $6,700 every year. Well, let me call and upgrade to a supplement plan. Well, at that point, you're not within that 6 months of either turning 65 or getting your Part B, then you are subjected to medical underwriting. And if you've had a health issue, like a heart attack, well, you can't get on a supplement until that heart attack's over 2 years old. If you've had a cancer diagnosis, you're not going to be able to upgrade to a supplement until that's 2 years old. So I'm not steering you towards a supplement. I'm not anti-Medicare Advantage plan, but I just want to make it very clear that you will have to medically qualify to get a supplement if you do not join when you first get on the Medicare Part B. So, which is better? Let's look at it. Both Medicare Advantage and supplement plans are good. Both are most likely to offer better coverage than you've ever had. Medicare Advantage plan works like your group insurance did when you've had your whole life, but the premium and deductible is probably less than what you've had through your group insurance. So if you looked at the Medicare Advantage slide that we looked at, you're like, hey, I've kind of seen like this before. I got a copay for my doctor visit. I got to pay if I go to the hospital, a few $100s a day or whatever it is. I've seen this before because it's similar to your group insurance. It's actually probably better than your group insurance that you've had your whole life because, again, most HMO Advantage plans have a zero deductible. So it kicks in right away to where the insurance you've had your whole life, you probably had to meet a deductible first. Then also premium-wise, when you were working, your employer might have paid 50% of your coverage, which is standard. Well, if you go with an Advantage plan, a lot of the HMOs in most areas are going to be either nothing additional to what you're paying Medicare or maybe up to $70 additional. So again, it's pretty cheap per month, and it is pretty good coverage. But again, looking at a Medicare supplement plan, the reality is a Medicare supplement is going to be the best coverage you've ever had in your life. Okay, as an agency, we offer both Advantage and supplements, and the supplement coverage, we never get any complaints. I mean, as long as they pay their monthly premium, they're never really going to have a bill. They don't have to get permission to use it and then go to any doctor, any hospital. So if you ask people that have a supplement, their biggest complaint is premium. Hey, I get a rate increase every year, but we address that as well, and I'll go over that here in a little bit. So how do you choose? How do you choose between an Advantage and a supplement? So this is something that when I train agents and when I present both, This is a question, after explaining what I've done so far, that usually people get a gut feeling in their stomach. And they kind of know either they're a Medicare Advantage plan person or they're a Medicare Supplement person. Because again, there's no wrong answer. It just depends on what's right for you. Okay? So I'm going to ask you this question, and then you'll probably get a feeling in your stomach, and you'll know. So answer this question for me. If you choose a supplement plan, and it costs you, let's say, $120 per month, and let's say you stayed in great health for the next 12 months. So you did not really use your supplement plan that much. Maybe you just went to the doctor 2 or 3 times. Maybe you got, a physical and some lab work done. So you didn't really use that plan, the supplement, too much. Would you consider that additional $120 a month for the supplement that you're paying a waste of money? Like, oh, I should have gone with Medicare Advantage. Why am I paying this $120 a month? I'm not really using it. I don't see the money in it. I'm not getting my money out of it. So it's a waste of money. I shouldn't have got it. Or because you are 65 or older, and at some point you will use this coverage, and you're paying $120 a month for it, but you're paying for full coverage, would you consider that $120 per month a cost of living? Like, just like all your other insurance plans. You might have had homeowners insurance the last 30 years, and you maybe never had a claim, or maybe your claims have not added up to your premiums over the last 30 years. Or car insurance. Maybe you've been paying for car insurance the last 30 years, and you've never even used it. Okay? But we have to have homeowners insurance. We have to have car insurance because we have to be protected. So again, an Advantage plan is going to give you good benefits. There's nothing wrong with it. Okay? But you could potentially spend up to $6,700 a year on it. And you have to go to certain doctors and get referrals. A supplement, it's $120 a month, but you're paying for full coverage. You go anywhere you want to go. You never really have a bill. So if you're 65 or older, would you consider that a waste of money or a cost of living for that extra $120 a month? If you answered waste of money, no problem. Go with an Advantage plan. No worries. We'll get a list of your doctors, get a list of your prescriptions, and we'll find an Advantage plan that's going to cover you well. If your answer is, well, cost of living, even if I don't use it, I got the peace of mind. I'm retired now. I'm on a fixed income, so I know what my health care cost is going to be by paying that premium. So it's a cost of living. Well, then you're a Medicare supplement person. So my name's Robert Bache, as I mentioned. People call me MedicareBob. I have over 50 educational videos online. I've been on the news for helping people. My company, Senior Healthcare Direct, has a A+ Better Business Bureau rating. I'm very big on 3 things on why people should work with us. Education. This is really this is why I'm doing this video, this presentation. This is why I travel nationwide and do these things. Our mission is for people on Medicare to actually understand their plan. I am such an advocate that people know what they have. You'll be surprised. I'll start a presentation, and the first question I'll have to somebody, let's say is 70 years old, is, what is your current plan? Oh, I have a 0 premium supplement. No, you don't. There's no such thing as a 0 premium supplement plan. And then I do some more fact finding, and I found out that they have a Medicare Advantage plan. Or I'll ask them, what supplement do they have? Do you have Plan F? Do you have G or N? And they don't know. So what's cool about us is we're not really salespeople. We're advocates, because our goal is that you truly understand the plan you select. And because the next bullet point is options. Well, we represent all the top companies, and we offer both Medicare Advantage and the supplements. So no, I'm not biased on whether you choose Advantage or supplement, and I'm not biased on which company you choose. I want to help get you the best value, the right plan. If you think that I'm steering people towards supplement plans, I'm not. I'll just give you some honest feedback. We do about 3,500 enrollments a year, and after we do this presentation, 85% of the people choose a supplement plan, and 15% choose an Advantage once they truly understand the difference. I'll say that again. For most people, when they are properly educated, 85% over the last 5 years, doing about 3,500 enrollments a year, choose a supplement. 15% choose an Advantage, because again, it's not a bad option. Some people, even if they want a supplement, they either can't afford it or they're not healthy enough to get it. Okay? But just giving you some honest feedback on the difference. The customer service on a supplement is very simple. Help them with their monthly premium every year, which is the customer service. We do annual reviews. So every year they get a rate increase. Every year we shop it to make sure they have the best price. And then also we help them with their drug coverage, which is a different videos that I've done that we could talk about every year. An Advantage plan, the phone rings all the time for customer service as well, which we do not mind doing. But what that tells me is that there's a higher level of dissatisfaction with those plans, dissatisfaction, because they'll call me and say, my doctor took it when I signed up, but 4 months later they're not taking it. Or, hey, I didn't realize I had a $450 copay for an MRI. Or like there's just a lot of stuff with an Advantage plan that people, when they just focus on the zero premium, or maybe there's a dental discount program in it, that they choose. Now, again, both products are available, and they're both the right fit for the right person. My main thing is, one, education. You understand the difference. Please just understand the difference. Options. Once you understand the difference, let's get you either the right Medicare Advantage plan based on your doctors and your prescription needs. If you are a supplement person, then let's find the supplement. For example, I like Plan G a lot, but let's get you the best price. Don't just go with a company that you've heard of before that might be charging $50 more than another company you've heard of before that's really good. Okay, because the plans, the benefits are the same. And then customer service. We do annual Medicare plan reviews every year. Every year. We email you. We'll contact you. You give us a call, shoot us an email, and we'll take a look at your plan if you want to, if you get a rate increase. And then also, we have our own customer service department. This is so cool. But when we were smaller, our customers would always tell us, wow, really wish I could just deal with your office all the time on everything instead of having to call the carriers, because as good as the carriers are, their customer service departments are often overloaded or not really trained very well. And so there's a lot of complaints that we would get about just trying to get a hold of someone on the carrier level. Well, now that we've been successful and we've been around now almost 5 years, I've been able to grow, and I have licensed agents that actually do all the customer service for you. So you don't have to call the carriers. We say call us, don't call the carriers. And we have a dedicated support staff just for that. So now you understand the difference between Medicare Advantage plans and Medicare Supplement plans. Which is better? It's really which is best for you, right? Either you see the monthly premium for a supplement as being worth it, as the peace of mind, you can budget it, you can go anywhere you want to go, you never really have a bill. Or you see an Advantage plan and say, you know what, it's just as good or better than the group plan I've always had my whole life. Maybe you have the money set aside that if you had to meet that $6,700 for a few years, you could do that. And you don't mind being told what doctor to go to. So there's no right or wrong answer. I do ask that you like and share this video. Please, I'm very big on educating people. And you can be advocates too, because you have friends your age. On Facebook, you connect with them from high school and all over, and your peers. And they don't have to call us, if they don't want to. Obviously, I hope people see this and we build credibility and you want to work with our agency, because I do believe we are the best at what we do. But if you just like it and share it, then that will help spread this. That will help. Facebook will say, oh, you liked it, so then maybe your friends will like it. Or if you share it on your wall, then your friends might be able to get something out of it, because it is important to me that people understand the difference. So thank you so much for your time. I will plug us. If you have Medicare questions, concerns, if you are turning 65 and you want to learn more about Medicare, call us. If you are over 65 and you have a supplement plan, but maybe you think you can do better on price, call us. Because if you've had the same supplement for over 3 years, you are most likely overpaying. But thank you for your time, and I hope you found this helpful. You can also comment any questions that maybe I did not address down below, so that your peers can see it and maybe I can answer those questions. So thank you so much for your time.